Well, you're welcome back to The Pulse. Now, today is World Malaria Day, and data from the Ghana Health Service shows decline in the number of malaria cases here in the country. The Western region remains a major hotspot with cases actually climbing yet again. Shortly, we'll be joined by officials of the Ghana Health Service and the Noguchi Memorial Institute for Medical Research, who've been looking into the problem of malaria here in Ghana. Let's bring you some data on malaria here in the country. Ghana is amongst 11 countries which contribute to 80% of sub-Saharan African malaria cases, and it is having a toll on healthcare delivery here in the country. Nearly half of all of our outpatient department visits at the country's hospitals, that's around 41%, were suspected to be malaria, with 20% of those confirmed as being the case. Nearly 20% of the hospital admissions as well were due to malaria, with 1% of inpatients dying as a result of the disease. It is the highest disease expenditure on the NHIS, whilst it's estimated to have reduced the country's GDP by some 0.25 to 6%. We can now listen to Dr. Kezia Maun speaking at a news conference in Accra today to mark the World Malaria Day.
Just the ending of last year, in October 2021, WHO gave a positive recommendation of the pilot that we did. So it's recommended that the use of the vaccine should be expanded, and currently there are mechanisms going on, there are discussions going on as to the modalities for the expansion, the resources, the vaccines, how we'll get them, what quantities we'll get. So I'm sure very soon, when things are well defined and set, we would come to the media and tell them exactly how and where the expansion would be, how much we need, where the vaccines are coming from. But we know that eventually we'll be expanding beyond the pilot district. Go on, we'll be able to give more details as to where the funds will come from, certainly from donors and the government as well. But the specifics are we are still negotiating and working on those. Yeah, it's a cause to worry that they are recording high cases, but I mean, you can get the nets, and if you don't use them, it's just like you haven't got them. So even though they are effective interventions, we have situations where people are not patronizing these interventions, and that's why we are seeing some of these statistics. Thankfully, the deaths are going down because our medicines are effective. People are getting to the health facilities earlier, but we need people to embrace the interventions well. If you can't sleep in a mosquito net, get indoor residual spraying in your homes, and then we'll all together fight this disease.
Well, so that's Dr. Kezia Maun, National Malaria Control Program Head. A very worrying burden there, but it's not all doom and gloom, as there are interventions, trials, as we understand, and a number of things that are happening to address this worrying trend. So first of all, there's the use of insecticides for bed nets, addressing the sanitation issues as well, sensitization, and we also have the issue of vaccination. So what's the plan to address this particular issue? Joining us in studio now is Dr. Nana Yao-Pepra, who's the medical epidemiologist at the Ghana Health Service, for us to have this conversation. We'll be also speaking to some other officials to help us understand what's happening in terms of malaria here in the country, Ghana, and what can be done to effectively address the situation. Dr. Pepra, such a good time to have you in our studios. So talk to us, first of all, about malaria. And well, we've heard the statistics, we've heard about the figures as well, but are we safe? I guess that's what everyone out there wants to know.
Yeah, so if you look at the statistics, I guess we are very safe. We are safe because we have come very far. 2017, we're recording about 600 mortalities a year for malaria. Last year, we recorded 275. It means we are doing it. It means something is working. There's a deliberate.
When you say 275, you're
275 mortalities.
Okay.
I mean, yeah, these are numbers that you say, okay, there's a reduction. But if we all know that if your relative is part of the 275,
it's not a nice development for you.
You know, right. So it's a good reduction. It's something that we can be proud of. What it means is that we have interventions in place that is working. And so we can't say we are safe because we are working and the incidents are reducing, mortalities are reducing.
But then the effective way to put an end to this is, I guess, the concern for many of you at the Ghana Health Service. There are issues of vaccination, there are issues about treatment itself, but let's start from treatment. The drugs we're having, and just as we heard from the head of the program, indicating that the drugs are becoming more efficient. Is that gradually replacing that program for vaccination entirely? Is that the case?
No, not really. So basically what she was saying was that you remember we used to have chloroquine.
Okay.
We're giving a lot of injections, we're taking medications, we're suffering. Unfortunately, over the years, it lost its efficacy, and we had the ACTs. So what we have now is the ACTs, and the ACTs are working very well. So even in the event that you have malaria, we don't expect that you die if you go to the facilities early, because the ACTs we have are working very well. The vaccines are not in to replace any of the interventions. The vaccines are aimed to add on to the interventions, and that's why we are happy about it, because with the interventions we had earlier on, we've been able to make some progress. So with the addition of the vaccine, it means that we can clearly see elimination in sight. So I believe strongly that we are very safe. We shouldn't be worried at all. If only we are going to use the interventions very well.
So really, where are we now in terms of vaccines? Have we made progress? Have we made a breakthrough? Because we had reports some time ago that even here in Ghana, some trials were being done. What's the status?
So if you remember, I think in the first quarter of 2019, we announced the pilot or the phased implementation of the RTSS vaccine. This was done in 3 countries, including Ghana. So Ghana, Malawi, and I think Kenya. Right. And this vaccine was, the phase 3 clinical trials have been done. We knew that it had some level of effectiveness. But the objective of the phase implementation was to see how it's going to function in the routine system. So from 2019 to date, this has been done. And just October last year, the WHO concluded that looking at the data available, it would be a good thing to roll out across the countries. And so...
Also, it started?
Yes. So wow. We've done the phase implementation. Okay. Now we know that it can be implemented as part of the interventions. But of course, you need donors, you need partners to come on board to bring us money, and then we have to produce more before we can implement it across the country. So it is being implemented in some districts, but for us to roll it out, there's still some discussions with stakeholders.
It appears it went under the radar, probably because of the COVID-19 pandemic. Is that the case?
In 2019, I think there was a lot of noise about it. Then COVID came in 2020, and maybe it went under the radar a bit. But I think we made a lot of noise about it.
So what's the plan for coverage? Or is it the case that we're just trying it for now and that it's not safe for you to just walk in and say, I need a malaria vaccine?
We are not trying it. Now we have gone beyond
the trial. Yes. So can I walk in? Can I go into any facility and say?
The vaccine is actually for children under 5.
Okay.
You know, they are the most vulnerable group.
Right.
So it is not for adults. For the children under 5, if you are in a district where it is being implemented, if you take your child for vaccinations, you'll be given.
Okay, so this is just for that age group?
Yes.
But how about the adult population? These are persons who also could have malaria as well. So why are you not covering them on this package?
So as I said, this trial was done within that age group, and we realized the effectiveness within that age group. Okay. We also have to note that, as we keep on saying, the effectiveness of the vaccine was around 30-40%. It wasn't like the other vaccines that are usually around 80-90%. But the good news is that for those of us in endemic areas, for instance, you might have carried some parasite, malaria parasite, and not get the disease. You know, so comparing you to the child under 5, that person is more vulnerable. So the concentration was more on the children under 5 to protect them. And also, as we protect them, we get to protect you, because then the parasite will not carry a parasite. The mosquito will not carry a parasite from the child to you, because it has been cleared.
So yes, preventive measures as well. I'm sure that you are not losing sight of that. So give us some public education on that.
Great. So at the program level, what we do is to preach prevention, because we believe that it works very well and it helps everybody. So we distribute a lot of mosquito nets, insecticide treated nets. And what we do is to distribute this every 3 years. So every 3 years, we do what we call a mass distribution. In 2019, 2020, 2021, we distributed some nets across the country. We also distribute nets at the antenatal clinics. If a pregnant woman goes to the facility for the first time, the pregnant woman is given net for free. If a child is taken to the clinic for child welfare clinic and is due for measles 2 injection, the child is also given net for free. We also distribute net through the schools. So we try as much as possible to saturate the households with net. Aside that, we have an intervention called the larval source management. You know, the baby mosquito breeds in small waters, small fresh waters. What we encourage is that as we do environmental management, we clear our gutters, we clear the weeds around our communities. If there are pockets where we have the larvae, that's the baby mosquitoes, we spray those areas. That's a larval source management. Aside that, we also have an intervention called the indoor residual spraying. Right. In the indoor residual spraying, we have an insecticide which is sprayed in the interior walls of the rooms, and this insecticide could last for about 6 to 9 months. The approach is that after studying the behavior of the mosquito, when it bites, it goes to the walls to rest. So when they rest on the walls, they imbibe the chemicals on the walls and they are knocked down. Right. You know, so these are all preventive interventions. We also have some chemo preventive interventions like what we call the intermittent preventive treatment for pregnant women. Okay. If someone is pregnant and goes to the hospital and is 16 weeks, we give them a medication called sulfadoxine pyrimethamine. Right. And with that medication, it prevents you from having malaria or bad outcomes from pregnancy. Because if a pregnant woman gets malaria, for instance, you could lose the baby. Yes, you could lose the baby. The baby could be small for age, and the mother could also die from the malaria. So we do all those things to prevent malaria.
And it's good that you're talking about insecticides. I just wanted to pick up your thoughts on that. Are there side effects to that, using that approach in dealing with malaria?
So because we know, of course, there could be some side effects if it gets close to human. Okay. Right? And so that is why the insecticides are sprayed on the walls. Right. And they are sprayed by people who are protected. So if you see them spraying, they have covered every part of their body so that they don't even come into contact.
But there are commercial products out there.
So
for the commercial ones.
Yes, for the commercial ones, I think that we at the program level, we work with what the data says. So if we don't have evidence that your insecticide works and can actually kill the female Anopheles mosquito and prevent malaria, we are not going to ask anybody to buy a product. So we really don't talk about the commercial ones until we have evidence.
So it's not as though it's a broad stroke. You don't apply this to everybody to say, well, yours is not effective, and that there could be some
not at all. What we use are scientifically proven to be effective.
Products, right. But in fact, joining us now as well is Dr. Linda Avva, a Senior Research Fellow with the Immunology Department, Noguchi Memorial Institute for Medical Research. Dr. Avva, so we understand that there's a breakthrough in terms of vaccines as well. But today, first of all, let me take your thoughts on it. It's World Malaria Day. At Noguchi Center, how are you celebrating this day? And with regard to the breakthrough, what more can you tell us about the vaccination process as well? Dr. Avva, you would have to unmute for us so we can hear what exactly it is that you're telling us.
Okay, sorry for that. So thank you so much for having me. At Noguchi, we mainly do research, and we do with the malaria control program. So we work with Dr. and his team a lot. And for most of the evidence-based events, we probably carry quite an amount of research out for the NFCP and in partnership with them. This year, the World Malaria Day, well, every year, World Malaria Day is April 25. So it actually is falling on Monday. However, we have begun with publicity and a whole series of events just in counting down to the actual day itself. We have quite a lineup of activities. We'll be having a lot of educational campaigns in certain districts just to make people more aware of malaria, how to prevent malaria, how to treat yourself if you get malaria. We have documentaries that we are putting together, and then we have symposiums and other events. Now coming back to the malaria vaccine. So it is still in the infancy. We realized that for the past few years, we implemented a pilot study, we implemented vaccine trials, and we found that it was good to an extent. I mean, it's much better than not having anything at all. So we're very happy that at least we have it. But there is, we're still working on actually hoping that we would get some more effective vaccines to help with malaria eradication. I think that's probably what I would contribute to malaria vaccine. For now, as Dr. Pipa says, it's mainly for infants and children. And that's because they are mainly the ones who, when they get malaria, they actually can die because of malaria. Hopefully, we would get a product that we can use for the larger population. But for now, this is what we have.
And obviously, you are the experts. So how are you helping the Ghana Health Service to scale up education and also the understanding of many out there who want to know much more about the disease and how it works?
So, yes, we are the experts. How are we helping the Ghana Health Service? Well, we are always available if we are called upon to give talks. We actually do occasionally go around. So we work in a lot of communities. Most of us at Noguchi have projects where we're working in certain rural areas because malaria is actually more prevalent in rural communities than in the cities. So we do work in rural communities. With all the programs we have awareness surveys, we have campaigns, we have educational programs with school children. So we actually do quite some amount of publicity. Yeah.
Okay then, Dr. Avva. So let me come to you, Dr. Pipa. And obviously we're talking about the need to scale up education. That's why I asked initially. So the point about getting to many people out there to understand how this whole thing, and because malaria, we just hear about it. We may not know much more about it, but just the mere fact that you hear about the disease, many people feel they know enough about it. What are you doing to scale up education on this subject?
Yeah, so you are friends, and you are key in this area. Yeah. So it is a deliberate effort to use the media, also use the social media platforms through Ghana Health Service website, our Facebook account, and the Twitter account, etc., to reach out to people. We also try as much as possible. You see, the Ghana Health Service structure is such that we are just not at the headquarters level. There's a regional, district, sub-district levels. And so at all the levels, it's expected that they meet the communities through their beds and talk to people, go to the churches, go to the mosques and talk to the people, educate them about malaria. And so even though we'll be commemorating the World Malaria Day, say at Hohoi, right. It is going to be done everywhere across the country, and people will be educated. And we are not going to just do it on 25th, but any other day we are given the opportunity, we also use that and educate people.
Okay, so what's happening on the 25th? Exactly explain what the activities are and what are you seeking to achieve with that day?
Great. So before the 25th, on Saturday, there will be a health walk. We actually want to exercise so that we can have muscles to fight malaria. So there will be a health walk. And then on the 25th itself, we'll go to Hohoi. We are going to Hohoi because Hohoi happens to be one of the 6 districts that has been selected for pre-elimination. We are thinking elimination now. We think that we have to do away with malaria, but it has to be stepwise. So 6 districts have been selected to move them into pre-elimination, and Hohoi happens to one of them. So we go to Hohoi, we talk to the people there, we encourage them that pre-elimination is feasible, let's all come together and achieve that purpose. Aside that, after the 25th program, we are going to have a symposium, rightly as Dr. Linda Amwa said, where we are going to learn lessons from China, Algeria. They have eliminated malaria.
Oh, totally.
Yes. So we want to learn lessons from them and see how we can also do same. And then State May, what we'll be doing is to organize an award night. Where we are now, some people contributed.
Right. But I'm interested in the story of others, the countries that you mentioned who have completely dealt with the disease, so which means that you won't find the case when you go into their community.
Yes. So there could be...
Did they achieve that largely by by dwelling on the treatment or using the approach of the vaccination? How did they really?
In fact, they even didn't have the opportunity of the vaccination.
Wow.
So they were using the same interventions we have available to us. So all we need to do is to ensure that we scale up on the interventions and we get people to use them. So if you have a net, you use the net. If you look around you and there are breeding sites, you have to try and clear them. When we are all part of the process, we can achieve elimination just as Algeria and China have done.
And let me bring in Dr. Avva on this one. Dr. Avva, here we're looking for the best strategy, or Dr. Linda, we're looking for the best strategy, the approach that would suit us here in Ghana to learn from others and to achieve their target as well. For you, what's that best strategy in achieving that malaria-free situation here in Ghana?
For malaria-free, I think it's a mixture of interventions. Right. So as Dr. Prepra says, other countries have done this without vaccinations. And so vaccines would help, but nonetheless, we can still do it. We mix vector control with compliance in treatment, with just making sure that we protect ourselves from being bitten by the mosquito. I think we can prevent ourselves from getting malaria and reduce malaria transmission. And with that, eventually we'll get to eliminate the parasite. So it's not one intervention, it's going to be a mix of interventions and commitment to these particular interventions.
Is geography giving some advantage to other nations as compared to those of us here in Ghana?
Oh, I would think so, because in some places you don't have mosquitoes prevalent or present. Here we have mosquitoes almost year-round, and with the mosquitoes you have malaria transmission. So one of the major targets is to reduce the population of the mosquitoes, and with that we would have fewer mosquitoes causing transmission, and then we'll be able to help ourselves.
There are many who say, I mean, the disease itself is it's no longer scary. I mean, when you compare that to other diseases that we're hearing of here in the country and what we're hearing from our health experts and all of that, it appears we are fixated on just some. Maybe, and the perfect example here is COVID. So, given that situation, do you feel that the whole focus on malaria is shifting to other areas?
But I think that's actually a problem, though. So, malaria probably kills more Ghanaians than COVID. And so in as much as we have put so much efforts into COVID, if we had probably put half as much in malaria, we probably would have been in pre-elimination in quite a number of regions as opposed to just the select few. Problems. COVID is global. There is money in other countries and everybody is protecting themselves from COVID. But we need to focus, I think, a bit more on the diseases that are prevalent here that are actually killing us Ghanaians. And malaria is, I think, one of them. Malaria is still a problem in Ghana. It's a very big problem in Ghana, and it really needs a lot of attention. And thank you.
It's interesting that you're giving us that analysis, the fact that it's in fact COVID, it's killing more people than COVID. Many of us never averted our minds to that.
Oh, but that's very true. I mean, COVID is new. We're not dying by COVID that much. Probably the people who are dying are in communities where you get to notice that they're gone. Most people who die with malaria are probably in rural areas where we are not even noticing that they are going that much. But that's a really big problem. I think it's a very big problem that we need to channel in more efforts to getting rid of it.
Right. So we need to be wrapping up on this conversation. Dr. Prepra, let me take your final words on this, and then I'll come to Dr. Linda as well.
Maybe before the final words, if you have a disease that is contributing to 20% of your OPD,
right,
it's something that you should
be paying attention to.
I mean, and you're spending a lot managing malaria cases across the country. If there was a study that was done by Schroeter & Co. in 2019, and they demonstrated that if we are able to invest to end malaria, we are going to save billions of US dollars. The ones we are using in testing and treating, it all be economic gains for us. So it is something that we really have to focus on. We shouldn't be used to it, as business as usual. My final words, I think that we have demonstrated that elimination is possible. What we are asking is that we should all come on board. There should be a paradigm shift where people begin to think that we are now moving towards elimination and not stay at control. So the media, private sector, they should come on board, give funds to fill in the funding gap so that we can give advanced interventions and ensure that people have what they need to end malaria. Once again, malaria elimination is feasible. Let's try and get this thing done.
Well, obviously, we'll be on the lookout for the national celebration next week, right? Yes. Next week, as Ghana also plays its role in marking the day, but still on health as well. We know that starting tomorrow, the Ghana Health Service says it will roll out another phase of the COVID-19 vaccination. Let's get details of this. Joining us now is Sophia Quist. She's the Ayaso North Municipal Health Director. Dr. Quist, first of all, tell us about tomorrow's vaccination restart. What do we need to know about the exercise?
Yes, thank you so much for having me on this program. Well, for tomorrow's program, we're starting tomorrow. That's 21st of April. And we're starting with all vaccination from age 15 years and above, including pregnant women, and then to the elderly. So we are starting with, we have all the vaccines available. We have Pfizer, J&J, we have AstraZeneca. And then we are including our pregnant women because from the last year, March, we couldn't start with them because of data issues. But now, thankfully, we have them joining the program. And so we are going to vaccinate them as well. And we're actually going to make sure that we vaccinate all our eligible clients in terms of, for Greater Accra, we've been able to vaccinate over 50%. That's for the first dose only. And then for those who have been fully vaccinated, over 30%. So our main target is to now get those who have not been able to get their full vaccination. That's the second dose. And then we look at the booster as well. So our main target now is to clear those who are left of us in the remaining about 20% to have their first dose, and then we'll take on with the fully vaccinated. So this is our main focus from tomorrow. Thank you.
But initially, when the first phase started, there was this complaint about people not taking advantage of it. What's the different? What approach are you taking now? How different is that? Just to get more and more people to come on board and participate.
Well, we all know it's been a bit challenging, though we had initially, I think from December during the Christmas festivities, the uptake was good. However, when the face masks mandate was lifted, now we are seeing less people taking the vaccine. However, we have about 29 districts in terms of health, and so we have engaged all district directors to ensure that we mobilize the community, we engage the community elders, we engage the community volunteers. Thankfully, we have community volunteers right from the community. So once you engage them, they approach the people, they talk to the people. For instance, in Ayawaso North, Ayawaso East, we engage the community because we have language barrier. So when you engage the community volunteers, they talk to the people, they understand them, and they're even part of the program now. So our new strategy now is to involve the community volunteers, the community elders, the assemblymen, to help us and ensure that all the community people are taking the vaccine. So this is our new strategy. We're also going to do door-to-door approach. Though we still have the static ongoing, we have the door-to-door. That is, we walk to every door, we make sure that, are you vaccinated? We ask you. If you are not, we encourage you to take it. If the first dose, we explain to you why you should take the second dose. Because we are all aware that now, even though we are not mandated to wear the face mask, elsewhere in the Western countries, they are still recording some cases. Recently, we heard of China, of their recent lockdown, because there's new variants of the Omicron. And so we need to encourage everyone to take this vaccine, even though we are not seeing it how it happened last year. we still need to encourage.
Okay, but do we know about the centers, the number of centers you're creating, for instance, within the municipality itself? Dr. Chris, I'm losing you. Well,
The vaccine. Sorry.
yes, Dr. Chris, I was asking about the centers. Do we know the number of centers you're creating, for instance, within the Ayaso municipality? Dr. Chris, if you can hear me, you would have to unmute first of all, but I'm asking if you have details of the centers, where the centers will be, so people can go and take their jab.
We have that. I cannot have that on offhead, but for instance, if you come to maybe Ayawaso, it's per district. So every district have, for instance, in Tema, we have the Tema Center, we have the maternity center. Most of the facilities are having the vaccines available. We have the assembly also taking part. We have the, for instance, in Mamobi General Hospital, we have the vaccines available. When you come to Malata, all the health centers are having part of this program. And then it's more of district specific. So we have that enlisted on our page. There's a Greater Accra website with all the 29 districts. I cannot say them offhead, but I'm sure of Kolebu Polyclinic. I'm sure of almost all the centers, Rich Hospital, Adabraka Hospital. All the facilities are all involved.
So in terms of the availability itself, the previous phase, we witnessed some challenges where people would go to the centers and they're told the vaccines are not available. Have you put in place measures to deal with that this time around?
Yes, now we have more vaccines available than before. In fact, we are actually encouraging everyone to take part, because we don't want the vaccines to go waste. Our main focus now is to vaccinate everyone included, all eligible vaccines. So we have more than available vaccines now. So there's nothing like you run out of vaccines. If you don't have, every district have vaccines available as we speak. The preparation has taken place, and we've actually done, every district has gone for their vaccines, and we are stocking every fridge with all our vaccines. So there's nothing like stock out or there will be run out of vaccines. No.
Do we have updates on the exemption list now? Initially, you were exempting, for instance, pregnant women from taking the jab. Have you worked on that now? Do we have clearance on whether or not these people can also go in for their vaccination?
Yes. Now, per date, all pregnant women are supposed to take the vaccine. There's nothing to be worried about. We have all the data to assure us that it's safe. It's safe for all pregnant women. It's safe for 15 years and above. So no pregnant women should be afraid of taking the vaccines. It's 100% safe for every pregnant woman.
And in this new phase, what's the number? What's your target, and how do you intend to achieve that target?
So as I said earlier on, Greater Accra, I can only speak for Greater Accra, but not for national though.
Okay.
I don't have that off here. But for Greater Accra, we have a total eligible population of over 3 million. And per our previous vaccination, i.e. the NID we had somewhere in February, we're able to vaccinate, that's for those who took the second dose, about over 1 million population. And for those who took at least one dose, that's about over 80%. So our main target is to clear the 20%, ensure that all the 20% left to take their vaccine as in the first dose. And then the second dose, our main focus is to ensure that the 70% are also covered. So our main target is to cover first dose and the second dose, and then the booster as well. So we're encouraging all to take the booster.
What's the level of collaboration with faith-based organizations and some shopping centers? Initially, there was a partnership with some of these institutions and organizations just to expand your reach. Are you doing that this time around as well?
Yes. Yes, all hands on deck. So we're engaging all our private facilities, our NGOs. You know, we have the CHAG, that's a Christian health organization. They are also part of us. We're engaging. We're also reaching out to any NGOs who want to take part in this vaccination. All hands on deck, because now our main focus is to reach out to everyone. We are not discriminating against anyone. We are encouraging all on board. So our arms are open for any collaboration. And though, i.e., we have some part of us.
Dr. Quist, we're grateful that you've been able to update us on this exercise. It's April 21. Make sure that you take advantage of it. This is The Pulse. We'll return shortly after this break.